Good morning, and thank you for joining us this morning. We're here today to address some of the concerns of the community. This is Jessica Stone, Community Relations Director for Mitchell County Hospital District, and joining me this morning is Robbie Dewberry, CEO, Dr. Dee Roach, Chief of Staff, and Jennifer Hale. So we will get started. Dr. Roach, have we had anyone hospitalized with COVID-19 at our hospital?
No, we have not. Thus far, the cases that we have confirmed have been either asymptomatic or mildly symptomatic, and none of them have required inpatient care.
Thank you. And Jennifer, can you explain what contact tracing is?
Yes, contact tracing occurs when we get notified that somebody has had a positive COVID test. At that time, the Infection Control Department reports that to our local health department in Sweetwater, and they call that person under investigation or the positive COVID patient, and they make contact with them and they review with them their history of the last 14 days. Where have you been? Who have you been in contact with? And what days were you there? What hours were you there? They try and trace it down to the hour. Sometimes that's hard to do. People are having trouble remembering where they've been those 14 days. But they do the best they can. And if the person under investigation or the positive COVID patient says that, like, puts your name on a list and says, I was in close contact with this person, then you are notified by a telephone call from the health department letting you know of that potential exposure and what you should do from that point.
Thank you. And Robbie, can you speak to the HIPAA privacy laws and how they relate to COVID?
Yes, HIPAA is for everyone's protection, whether it's a patient or an employee of any facility, and there's certain information that we can and can't release as a healthcare facility. Even though, and I'm sure folks have seen that the HIPAA laws have been relaxed a little during COVID so that facilities such as us and the health department can share information, we are still obligated to protect everyone's identity that we test here at Mitchell County Hospital. So I know we've had some folks ask why we can't release that information. We still can't give out that information. The health department has a little bit more latitude because they're going to do the contact tracing, but we can't do that.
Okay, thank you. And Jennifer, can you explain the reporting process, and more specifically, can you explain the process when someone is not tested at Mitchell County Hospital?
Okay, I think you're if referring to the numbers that we report daily on Facebook.
Yes.
Okay, so the numbers that you see daily on Facebook are any positive cases that we have had either reported to us from the health department or actually tested here at Mitchell County Hospital. There have been cases where the person was tested elsewhere, but they notified us that they were positive. The health department did, and so we included that in our numbers. The only numbers we report are people that are Mitchell County residents. We don't report any other counties. Let's see. What was the other part of that question?
So basically what you're saying is regardless of whether they were tested at Mitchell County Hospital or not, they will eventually show up in our numbers as a Mitchell County resident.
Only Mitchell County residents, that is correct. And we're in communication daily with the health department to make sure that we're getting the right information. So we're sharing the right information.
If I could, I would like to, one of the questions we've had is sometimes why our numbers don't match the health department's numbers. And because it is such a fluid event, and Jennifer and her team have done a really good job of staying in contact with Nolan County Health Department, but there is that timing issue. So if someone is not tested here that has traveled outside the community and gets tested somewhere else, that's why sometimes our numbers don't align. But we get those updated as quickly as we possibly can. And we're trying to update those just daily. And so that's why sometimes those don't match. But I want everybody to be, to know that we are doing our very best to give them the latest numbers.
Okay, great. Thank you very much, and thank y'all for joining us this morning.